This morning we'll be hearing from the leader of an organization who serves as both a provider and a health plan, who is uniquely familiar with the end-to-end nature of providing patient care in this community. Mary Brainerd is President and CEO for Minnesota-based HealthPartners, the largest consumer-governed nonprofit healthcare organization in the nation. She oversees more than 10,000 employees in an integrated system spanning medical and dental health. The HealthPartners system includes 700 physicians at more than 40 clinics, 3 hospitals, a large dental practice, and has 1.2 million health plan members, a large research foundation, and an institute for medical education. Ms. Brainerd has been with HealthPartners since 1992. Prior to joining HealthPartners, she held senior-level positions with Blue Cross and Blue Shield of Minnesota, including Senior Vice President and Chief Marketing Officer. She was also Senior Vice President and CEO of Blue Plus, and before that, she was a marketing instructor in the graduate program at Metropolitan State University. Since Ms. Brainerd joined HealthPartners, the organization has received numerous accolades for outstanding patient care, health plan service, and its charitable community work. They were most recently ranked in the top 25 health plans in the nation by U.S. News and World Reports, and hold consecutive rankings for Regions Hospital as one of the top 100 hospitals for cardiovascular care. Ms. Brainerd herself has also been recognized as one of the top 25 women in healthcare by Modern Healthcare magazine. Her leadership track record of success certainly speaks for itself, and it's my pleasure to introduce her as today's featured speaker. Please join me in welcoming Mary Brainerd.
elections. Any unhappy members take their case directly to a committee of our board of directors, something that when I joined HealthPartners put me into shock. I'm like, I'm not a lawyer, and even I know that's not a good idea. But it's been part of our heritage of directly involving consumers in making decisions about healthcare, how we prioritize within healthcare, and continuing that practice of, if we don't have a health plan that owns a bunch of clinics, and we don't have a bunch of doctors that own a health plan, we're a consumer-governed organization that has both delivery and financing capabilities. There are a few like us nationally. Kaiser is pretty much like us. Group Health and Puget Sound is like us. But there are kind of a limited number of organizations that are structured this way. It's been one of the models that has been explored as an option under healthcare reform for expanding and changing healthcare. We have about 1.2 million members, really about 1 million members in our health plans, and another 200,000 or 300,000 members in our dental plans. Here's where we're going. So if you think about what do you really want out of the healthcare system, I think it's these three things. One is you want the best health that you can possibly attain. Some of that depends on us as individuals and family members. Some depends on the quality and the level of interaction with the delivery system. We want the quality of that interaction to be exceptional. And too often, people right now feel they can only enter a healthcare system when they have an advocate with them, worry about leaving a family member alone in a hospital. So this element of experience, what's that patient and family experience, is a big deal. And we actually think we need to be able to afford to pay the bill. And at 17% of the GDP, we're getting worried about the ability of our employment system and us as individuals to pay for that health care. And we think the measure for that is per capita cost per person. How much does that go up? How much is that incorporated in the GDP? So we think this triple aim is really what healthcare should be about. This, frankly, is our strategic plan with one additional element, and that's people, because we are an intensely service-focused organization and industry. And over the last 15 or 20 years, we've spent a lot of time telling people in healthcare that they should behave like any other business. And yet, when you enter one of our hospitals, or even when you come to one of our clinics, you really don't want us behaving like any other business. And one of the eye-opening experiences I had very early in my tenure as CEO at HealthPartners, went to a play at Medtronic. Medtronic was using theater to connect with their workforce. And I was so